But this year is different. Now more than ever, this roundtable discussion is essential as cancer survivors face a healthcare system and a country that is adjusting to the COVID-19 pandemic. There's a wider understanding of the inequities in the healthcare system, resulting in disparities in outcomes. Cancer screenings have dropped at alarming rates. Cancer research has been disrupted. Many treatments and clinical trials have been derailed, and cancer patients are more isolated than ever. However, despite these immense challenges, we remain hopeful. We have learned from the patients we serve that cancer survivors are uniquely prepared to face uncertain times with determination and optimism. We have a record number of attendees joining us today, and that tells me that we are eager and ready to tackle these issues and continue our work to improve cancer care. During this roundtable, with cancer survivors at top of mind, we will leverage the brain power of some of the most thoughtful leaders in healthcare policy to identify barriers and explore solutions. So now for our first panel. I've been waiting to hear from this panel since Election Day. We have experts from both sides of the aisle to talk about what to expect in the new Congress and the new administration. I'm thrilled to introduce our moderator for this panel, Julie Rovner, a noted expert on health policy issues. Julie is Chief Washington Correspondent of Kaiser Health News. She joined Kaiser Health News after 16 years as health policy correspondent for NPR, where she helped lead the network's coverage of the passage and implementation of the Affordable Care Act. Julie, thank you so much for joining us today to lead the first discussion.
Sorry, my unmute button wasn't working. Thank you so much for the kind introduction. Thank you for having me. I am so pleased to be joined today by two of my favorite people, both of whom I have known for longer than any of us care to document. We're going to chat amongst ourselves for a little while, and then we will open it up for your questions. But first, let me introduce them. Debra Curtis is Senior Deputy Director for Policy and Exchange Programs for the DC Health Exchange. That's the Affordable Care Act marketplace here in the nation's capital. Debbie is a veteran of Capitol Hill, where she worked for the House Ways and Means Committee and Health Subcommittee Chairman Pete Stark of California. Rodney Whitlock is Vice President of Health Policy for McDermott+Consulting. He's a veteran of both the House and Senate sides of the Capitol, including a stint as Health Policy Director for the Senate Finance Committee Chairman Chuck Grassley of Iowa. I'm going to start by asking you both to answer this question. Before we get to 2021 and the Biden administration and a Senate that's maybe still in Republican control or maybe Democratic control with a tie-breaking vote from the vice president, we're going to have a lame duck session. What's likely to happen in these last few weeks of this Congress? Sometimes Congress does really important stuff at the very end of the year, and sometimes not so much. So what are you looking for? Debbie, why don't you start?
Sure, I'm happy to start, but I got to tell you, anybody who's trying to forecast what happens in Washington, D.C. these days is in a dangerous business. So my really honest answer is who the heck knows? But in the short run, I will say, as someone who now, spent a long time in Congress and now works for the District of Columbia for our health benefit exchange, that, it's really important at the state level that something happen. I mean, DC, for the first time ever in one of these bills where we were getting, aid to the states to handle COVID, the district was treated as a territory, which is just unprecedented, and got a fraction of the money that was actually due based on our population and our needs. And I know we are running out of that funding, and we are pushing very hard for something to happen to help the states during lame duck. But I do not have that magic ball of whether it will happen. Maybe Rodney does.
Rodney?
Check. Nope, I don't see it anywhere. All right, so let's start here. The Hill is behaving as though the election's not over. And it's because the election's not over. The election's not over in two very important places. It's not over in the White House, and it's not over in Georgia. That until one of those two breaks, nothing is happening. When will the first one break? Okay, the White House should break first. Between now and the Senate returning on November 30, we're going to see every state where the election was very close, certify their election results. By the time the Senate returns, they're going to be in a position that things are becoming final enough that the White House may eventually get to the point that they recognize the election outcome is the election outcome.
And we should point out that the Senate returns the week after next, right?
November 30, yeah.
Right.
And so that when they do return, then they'll be in a position, we'll see where we are with the COVID numbers, what the attitudes are for the December 11th deadline, which is when government funding and a number of extenders run out. And listen, Debbie and I did these jobs. Julie, you've reported on us. When Congress says our deadline's December 11th, that really means it's December 18th. And so, if they come back with attitudes changed, then we might see a break from the stalemate we're in, or not, because Georgia is still outstanding, and that's when the election really ends. And so people are going to be reticent to make deals that they think they might get better if they just wait for Georgia. And so the election's not over, and that's what our hold is.
And when you say Georgia, you don't mean the presidential election, Georgia. You mean these two Senate runoffs.
Seats. Yeah, the two Senate runoffs, because the Senate is not decided until those are decided.
So, Rodney, for people who don't all know, what are the extenders? People talk about the extenders a lot, and I think people get an idea. I think of the spending bills, that if the Congress doesn't fund the government December 11th, things shut down. The extenders are slightly different.
It's a small set of provisions, but important to some very key stakeholders like community health centers and hospitals that take disproportionate share funding. And those are places where, again, in the midst of a global pandemic, when you're trying to treat people, having funding run out would be a bad thing. And so there's no hint right now that the government would shut down or that there would be, that these extenders wouldn't be taken care of. But until it's actually done, you're uncomfortable.
Debbie, I want to talk about what the agenda might look like depending on who controls the Senate, which, as Rodney points out, we won't know until these Georgia runoffs, which aren't until January 5th. So what would be the difference if there's to the health agenda with a Republican Senate, which I guess would be 51-49, or a 50-50 Senate with Vice President Harris breaking a tie?
Sure. Thanks, Julie. That is the question everyone wants to know. I mean, I would start, first of all, that, the cancer survivors and cancer patients and the families of cancer patients could not have a better person in the White House. So come January 20th, Biden is the best friend that you could hope to have in the White House. And I just think that's very, very important. And for those of you who were here 4 years ago, when Rodney and I were doing this panel right after the election, you'll note I am not crying today. I think we are in a much better place now than we were then, regardless of what happens to the Senate. But those two seats are fundamental for how much change happens in this upcoming session of Congress on healthcare and on many other things as well, but we'll stick to healthcare. So in the healthcare arena, I mean, here's the look that I'm taking at this is that we've had the Affordable Care Act in place for over a decade now. As hard as that is to believe, it is over a decade. It covers millions of Americans and it works. And it is working to provide coverage, whether you are a Republican, whether you are a Democrat, whether you are a progressive, whether you are a blue dog. It is working, and people know people who have coverage because of it. So, there are things I think that in a Biden administration, even with a Republican Senate, a slightly Republican Senate, you could see progress on. And I'll put out a few examples of things that I think are very important and I hope would not be completely stymied. I would take a look at federal reinsurance. The health insurance marketplaces, provide coverage for people to buy individual insurance that they pay for 100% on their own. When the Affordable Care Act was written, it had 3 years of federal reinsurance, thinking that everything would stabilize and the world would be perfect after that. That was a mistake. We can all admit it. The individual market is inherently unstable, and it will always be inherently unstable. If you can get someone else to pay your health insurance, you usually take that opportunity. Employer-sponsored coverage covers a lot of your costs. It's expensive to be in the individual market, and every year, premiums do creep up. And so doing something on federal reinsurance would be absolutely fundamentally important for all of the people who buy coverage through the marketplace. I also think the other area I would highlight where I think in a Republican world we could really have some consensus is doing the long overdue work we need to get to on health inequities in this country. And I think this year has really shone a light between George Floyd's murder and everything we've seen with COVID and the impact of health disparities in this country. They're tremendous. And if you're a cancer patient, it just shows glaringly there. I mean, where you live, who covers you, and how it impacts your care so tremendously. So that is not a partisan issue. That's a real issue impacting all of us. If we have a Republican Senate, I think those kinds of things we can move. If we have a slightly Democratic Senate, I mean, remember, Biden ran on a pretty centrist, agenda. He ran that we should build on the Affordable Care Act. So there, I think we have a lot more opportunity to add funding to the APTC, the tax credits, which make coverage more affordable for people. Hugely important. I think one of the most important things he could do is get rid of the 400% cap and instead tie the subsidies so that you don't pay more than X percent of your income, no matter what your income is. Because look, as we age, our health insurance is more expensive. And our incomes aren't going up as much as our health insurance premiums are. So I think you see that area. I also think on the Medicare front, you see a stronger push for maybe lowering the age of Medicare to age 60 and getting a few more people. That really is a twofer. If you cover more people in Medicare, you increase you benefit the Medicare pool, but you also benefit the private insurance pool, who no longer is covering those really expensive older people. And then, a lot of work around children as well, and more work that we can do to get kids covered in this country. I've talked long enough on this.
It's pretty ambitious agenda. I'm going to turn it to you, Rodney, but I first want to add something that Debbie said about reinsurance. I was on a radio program in Maine this week, and I had not realized until I did that when Maine put in its reinsurance, their average premium has now dropped 13%. And I think, is DC the other one where
No, we have not. I mean, we haven't been able to do it because it would cost us a lot of money. We can't use APTC dollars because our Medicaid program is really strong. It's Maryland that has been able to very effectively draw down their premiums. We were able to push really hard this year, and we actually got reductions. 15 of our 25 health plans in the individual market this year have reductions in their premiums, but we're not able to buy them down significantly, which is what reinsurance does. And the states that have been able to do that have seen so much value.
I would also point out, because this is probably going to be relevant as we continue this conversation, that there was almost a federal reinsurance bill in 2018, and it was felled by a fight over abortion, which is, of course, what almost took down the Affordable Care Act in the first place, and may well come back up, particularly in a very closely divided Senate. So, Rodney, the question, in case you don't remember, is what difference is the agenda going to look like, whether the Senate is controlled barely by Republicans or barely by Democrats?
The answer is it should be nothing. I think that listen, 50-50 or 52R and 48D, nobody's truly in charge. Passing partisan bills, again, everybody needs to check themselves. If you're looking at ultimately 224 members in the House are Democrats, quick history lesson for you. Last time a Democrat was Speaker of the House and had less than 232 members of the House of Representatives as Democrats was during the administration of Franklin Delano Roosevelt. Okay, Pelosi is engaged in a magic act that she has never pulled off before, doing something she has never been before, lame duck. So anybody who's got aspirations of majoritarian government at 224 and 50 is not thinking right. Really, if everybody can get their minds wrapped around small ball, and Julie, you brought up something that's really important. Listen, I'm bullish on actually talking about the ACA in 2021. The reason I am is because I'm somebody who thinks that Republicans aren't necessarily just 2017 and the position in California versus Texas. I think Republicans are just as much the folks in 2018 who are trying to work out something that would have been considered ACA stabilization, and Republicans who are a function of the 2018 electoral outcome where lessons may have well been learned. And so, the idea of putting some things that are smaller on the table to stabilize the ACA, to look at improvements, and I think those are very realistic. You want to bring public option in the room, you're welcome to. You'll be dismissed, but you are welcome to bring it in. But you can go now. I mean, you can talk about it, but you may leave. I mean, just it's not happening. So if you want to go big, go home. But if you want to engage in real conversations to make marginal progress to stabilize, that's real. It can happen.
Well, I definitely want to talk about
Rodney, that's definitely, I hope you know I was saying the same thing. That was what I was saying is, let's talk about the things that should be able to be consensus in a rational world. We're not in a rational world right now.
We're playing in the same place.
And I definitely want to get to some of those things. But first, there is hanging over everything this lawsuit that you mentioned, Rodney, California v. Texas, or Texas v. California. They're actually both there, which for those who have not been paying as close attention as we have, is a lawsuit that's now at the Supreme Court as a result of the 2017 tax bill that Congress passed that lowered the penalty for not having insurance to zero. And some creative Republican attorneys general decided that, okay, if there's no tax anymore, it was the tax that got the law upheld in the first place. So therefore, the whole law is now unconstitutional. And they found a federal district court judge in Texas who agreed with them. And then it went up to the appeals court, and they found 2 Republican appointees on a 3-judge panel who said, we don't know, but maybe the whole law doesn't have to go. And they sent it back to the lower court judge, at which point the Democratic attorneys general, who had been defending the law because the Trump administration was not, which was also sort of a head scratcher, because the Justice Department generally defends laws that get that get challenged in court. The Democratic attorneys general went to the Supreme Court and said, you really need to resolve this now. And the Supreme Court said, we'll take the case, but we won't take it now. We'll take it in the fall. This was back in the early part of this year, like just barely before COVID. And so we heard the oral arguments a week or 2 ago. I'm losing track of the days. And, most people think that the court's not going to buy this argument, but we don't really know what the court is going to do. So my question for you guys is, if the court does invalidate the whole law, which seems unlikely, or more possibly the part of the law that protects pre-existing conditions, would that finally prompt some response from a very closely divided Congress?
Julie, come on. You do this for a living. Find me a human being who listened to the Supreme Court on November 10th and didn't say, Supreme Court just said this whole thing's stupid. Now, we've all been saying that for 2 years, and look at them. They all just said it's stupid. Can you find me someone who is not like a Twitter troll, an actual JD, who thinks that the Supreme Court is going to throw out the whole kit and caboodle, versus someone who will say, Supreme Court might rule 9-0 that Texas doesn't even have standing. Come on, listen, you walk through the whole preordained list of stupidity that led to them getting there. But when they got there, the justices almost uniformly said, this whole thing's stupid. Why are you even here? Come on, are you going to make us go through, but what if in July they make us get rid of it and all of us, come on, are you going to make us do that?
Yes, because I've been wrong before. There are times when it really looks like they're going to do something and then they don't. With the Medicaid, the Supreme Court was never going to rule the Medicaid expansion, was coercive, or Congress had been expanding Medicaid that way for 20 years. And yet they did, and it was 7-2. You never know what kind of deals they're going to cut behind closed doors.
Okay, we'll play the game. Debbie, you go first. Let's do our patent. Let's go do our usual gig.
Okay.
It's the end of the world. Everything's going to fall apart. Go ahead, Deb.
Well, what I would say first off is I agree with Rodney, I hope. And that was certainly, I am not a lawyer, but having spent 30 years, on Capitol Hill, you learn to think like a lawyer. The common sense of this is that it makes no sense. So completely agree. I would say the biggest issue that faces the state-based marketplaces and people who are getting coverage through the ACA is the confusion it causes, because it gets covered in the media. The only term I can feel is Sisyphus with the ACA. You're climbing up the hill and you're rolling a little back, and then you climb up the hill. But we have not gone back. We haven't reached the top, but we keep going. And so we have a statement, and this is the 3rd or 4th time we've had to do it, where we have a pop-up on our webpage that says, the ACA is the law of the land. Please sign up and get covered. We won't hear anything from the Supreme Court for months. Just get covered, because the confusion is such a problem. I will also say that, using DC as an example, we have codified things like the pre-existing condition protection. So those things will stay in many of the states that took such actions, the states that have their own marketplaces. The real problem would come in that the Medicaid expansion and the financial funding for APTC are all federal dollars, and there is not a state that could come up with the money to do that quickly, especially during a pandemic where they're spending so much more money than they had anticipated in the health arena. So, I mean, it is very hurtful, this case, for getting people covered, and it's very concerning. I think the outcome's going to be one that we don't have to confront, but if we did, my hope would be that Congress would act quickly to do something at the federal level, because this would cause chaos at a very dangerous time.
Congress could make this go away before the court even rules. I guess with the court looking like it's going to do Congress's job for it, which I believe were the words of the Chief Justice at some point during those oral arguments, they might not have. But is there any chance that, how fast could Congress make this case go away if a ruling? And I agree. With Rodney, I think the chances of them throwing out the whole law are extraordinarily low. But I think the chances of them throwing out the mandate and possibly the things directly connected to the mandate, which are the pre-existing condition protections, I think those chances are not still zero.
I still think you're more likely to get 9-0. It doesn't have standing than even that, Julie. That if you read the transcripts, there was not the first hint of anything more than 7-2 with 2 in dissent, maybe even trying to go there. But okay, again, let's play the exercise. Again, flip the switches back on. Okay, you've killed menu labeling in America, flip the switches back on. You've ended biosimilars in America, flip the switches back on. The idea that Congress can't quickly come together and flip the switches back on, and that people want to, again, create the hyperbolic specter of Republicans being 2017, and that's where they are, and they wouldn't flip the switches back on. Feel free. I don't believe it.
So you think they would?
Oh, absolutely. Absolutely.
I'm not. Granted, I think that needing to flip the switch on the whole thing is unlikely, but I can see a world in which they would have to flip the switch on the pre-existing conditions. And most of the Republican bills on pre-existing conditions don't really cover pre-existing conditions.
If you want to flip the switch on pre-existing conditions for a year, you can do it. You say, okay, 2 years. Turn all the switches on for 2 years. And I, frankly, I'm almost occasionally insulted that I have to sit here and convince people that Republicans would flip the switches when I have to go, I think there aren't at least 2 Democrats might say, you know what, good, let's start over. We're not flipping switches. Let's start over. But okay, I'll defend Republicans. Feel free if you need to make that argument. And you don't have to say, no, gosh, no, the vapors, a Democrat would never do that. Oh, hell yes, they would. You know that.
Oh, I can see that.
And you know who they are. Crazy here.
And there's some new ones.
Yeah. There'll be more than 1 or 2 Democrats going, oh, no, that's good. Let's just start over. We don't need to flip switches back on. Again, I think that you'll get plenty of folks across both sides to go, turn the switches back on, turn the switches back on.
And just to be clear, you're talking about Democrats who would be fine with it going away so they could start over and do Medicare for all. You're not talking about moderate Democrats. You're talking about liberal.
I'm talking about the folks on the left. Most would be perfectly happy going, we got it wrong the first time. Let's start over.
And all right, well, I do want to talk about some of the smaller things that are more likely to happen. But first, I feel like we really have to address COVID. Congress and the president were really active early in the year. They did the CARES Act. They sent out a lot of money. And then nothing. What is it going to take to break that logjam, or to get Mitch McConnell to even sort of come to the table?
I sort of think, well, first of all, politics. Last I checked, Mitch McConnell wasn't asked to be at the table throughout much of the summer through the fall, where Democrats thought, hey, here's Steve Mnuchin. Let's work a deal with him, because that way we don't have to talk to Mitch McConnell, because he might disagree with us, and Mnuchin will give us everything we want because he's proven he would do it before in the CARES Act. So let's do that again. Didn't work. And also that in between, the president appointed a new chief of staff to be Mnuchin's hall monitor, which in Mark Meadows, which may have stopped it as well. I think one of the questions should be, which is, and I think Deb is a great person to discuss this right now, which is, okay, what are the things right now DC needs? And, are we talking, DC? Are we talking airlines? What are we talking? What is that list of things? Is it a $2 trillion? Is it a $4 trillion? Is it $1 trillion that right now ought to be done? And is it just, again, both sides are like, nope, we're right, you're wrong, and we're not going to even try to bridge the gap. That's a both sides issue.
Deb?
I'm trying to figure out where to take this. I mean, I think it is really, we are hitting the point. I mean, DC has been doing free testing. Just this week, the mayor announced that testing will continue and no one will be charged for it. But if you have health insurance, they're going to be asking for it so the city can get reimbursed from health insurance in order to, be able to continue this longer. We need more federal support on COVID. We need it. The other thing that I think the federal government has really not done a good job on, CMS never did a COVID special enrollment period for people so that people could come in the door and get covered when they needed. This is really important. We're in open enrollment now, and people say, why do you need a COVID SEP now? Because you're in open enrollment. Well, look, if I needed health insurance, I realized right now I've been exposed to COVID, I better get insurance. I've been putting it off. This is not the way to buy insurance, anybody. Get covered already, but I'm just being a very bad actor right now. I'm gonna go get my insurance. In DC, you would go online, and if you wanted to do open enrollment, your coverage would not start until January 1. But if you use our COVID special enrollment period, we let you, the customer, choose. Do you want that coverage to go back to November 1 because you were diagnosed and you want to be sure you're covered? Or do you want it to go for December 1 because you're willing to, you can't afford to go backward and you're willing to go with December 1. So we let you get immediate coverage through that COVID SEP. That is really important. I mean, in DC, we have 97% of our residents covered at this point through the work that we've done. So we're not an example of, someplace where we think we have a lot of people walking around uninsured, but that is not true across America. So this effort to get people covered is hugely important and needs to be supported at the federal level. And we need to be doing things that drive that coverage so that we don't end up with higher and higher costs being hit on our hospitals who get the uncompensated care to do this, and then our states who end up having to try to pick up and help with those expenses. So those are the things I would be pushing on right now very strongly.
So Mitch McConnell, I noticed yesterday, mentioned the word omnibus when he was talking about getting a funding agreement for the government by the December 11th deadline, or as Rodney correctly pointed out, more likely December 18th or 19th, because they'll just keep putting it off in one-day increments. Do you see a chance that they could bundle, there some COVID relief into that package, that there would be one big package? I guess is my big question. It's from the beginning. Are they ready to deal in the lame duck and do something? And there's another sort of tranche of unemployment insurance running out the day after Christmas. That can't be what lawmakers really want.
So Deb and I did these jobs, and we did them together. We worked together on issues. Deb and I right now would be ready to act. Somebody's just got to tell us to do it. So I think if you talk to the folks on the Hill right now, they'll tell you they could do a lot if they're told to go do a lot, because they haven't been sitting around twiddling their thumbs. They have worked. They have continued to work. They are fully capable of launching and saying, okay, you give us our parameters, tell us what we're supposed to turn around. We will produce it for you. So Julie, that's sort of my answer to that question, which is they are capable of doing it. They just need to be told launch.
And who's going to tell them is the big question. Are they do still appear to be listening to the president?
That there has to be some level of agreement between the leaders of both houses and the administration. If they come to some level of agreement, you could move a lot. You could move a lot in policy, you could move a lot in funding, but they have to reach that agreement. And we talked at the beginning about the challenges they face.
Yeah, and it's just, I will say, sitting now outside of this, it's very hard to see that happening in the next few weeks. I am hopeful, because you have to be hopeful, and none of the three of us would still be doing what we're doing 30 plus years later if we were not optimists. So can it happen? Yes, but it does not look good right now. It really does not look good. That's why locally we've done all these things on our own. I mean, we've said in DC that there are no health insurance terminations. Our insurance commissioner said no health terminations during COVID. And during our public health emergency locally runs till December 31st right now. We fully expect it's going to be extended, again, I just given what's happening right now. But we also, our insurance commissioner has said, and this applies for small businesses, big businesses, if you're insured in DC and you can't pay, you have back owed premiums, you can't be terminated, you also get a whole year to pay back those back owed premiums. And that's something that's hugely helpful for our small businesses. And at DC HealthLink, we cover all the small businesses in DC. If they offer coverage, it's through us. So we're saying you get a 60-day window when the pandemic ends, when our public health emergency ends, you'll get another 60-day window to try to get things back on track. And then we're going to automatically spread whatever they owe back over the next 12 months and just bill them that way. They don't have to ask for it. They don't have to do anything. We're trying to do everything we can within our own power to make this as easy as possible for individuals and businesses, because, we're facing unprecedented times and we don't see help coming from anywhere else.
So I want to go back to some of the small ball things that you guys both mentioned in the first question. Before COVID, Congress was trying to come to some kind of a deal on surprise medical bills, obviously a big concern to cancer survivors, and prescription drug costs, also a big concern to cancer survivors. Are any of those, those are things that were bipartisan and presumably could be bipartisan going forward, although once you get into the details, it gets a little bit tricky. What are the prospects for sort of those two issues going forward into 2021?
So I'll jump in on surprise billing real quick. That's an easy one. That can be done in minutes. All you have to do is have, right now the position on that is that you have a dispute between committees and with some powerful allies within leadership. But Deb and I, doing these jobs, we work out an agreement in minutes.
But the dispute is
really
between the parties. It's between the insurers and the providers. Everybody agrees there shouldn't be surprise bills, but they each want the other guy to pay.
The internal dispute in Congress is not between that. It's between members of certain committees and aligned folks within leadership who take one position and others who take a different. The gap between them is just not that significant that they can't work out a deal if they want to.
They have not been able to, though, Rodney. And they haven't been able to because of the special interests that they are listening to on either side. This is not purely political. Special interests are a big component of this. And I feel like, this is just my personal opinion, I don't see resolution on this. I see this as a really stuck issue. And it is, I would almost advocate moving on to something else to achieve a result and then maybe coming back to this one. I just feel like this has almost become, that speed bump that you just can't get over and nothing else happens. I feel like it's ridiculous. There's a compromise to be had here. I thought there was a compromise that developed that was, taking a little bit from both sides, but people don't want to get to yes here.
Well, no, yes. Now that, again, I think you and I can agree that the gap between the Ways and Means provisions and the Energy and Commerce and Health Committee provisions are not the Grand Canyon. So they are actually quite close, particularly once the savings are considered, that they're not far away. But you're right. If you want a deal, you can get a deal, but you have to want to. I'll totally agree with you on that.
What about drug prices?
So first thing you have to do is you have to decide, when you say drug pricing, do you mean putting a reference price on the top 250 drugs in America sold by volume, either through a Medicare negotiated rate or international price index type reference? Do you mean
That's
that?
one possibility.
No. Nope, 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 no, 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 not happening. Nope. If you mean something else, if you're willing to set that aside and say anything other than that, I'm not going to describe as failure and say everybody else is a beholden interest. If you aren't willing to take that position, you can get something done. I mean, listen, I'm old enough to remember where the Republican bill, HR 19, that was put up as a comparison to HR 3 on the House floor 4 years ago, that had been some radical stuff that they put out there. Chairman of the Finance Committee, incoming chairman of the Finance Committee, supports that. I mean, if you're willing to move away from your definition as being a reference price, you can get something done. If that's only your definition, you will fail.
Deb?
I don't have great insights on this one. I am not in Congress now. and it feels, I mean, there is a real need to do something on this. And what you have on this one is the health insurers really weighing in that this is their top driver of costs. And so I think that's a value add. If you can think about how to maybe take bites at this, you may not fix the whole thing, figure out some policies that take bites. I think you could make some real progress. I don't think it's something given, again, and I hate to sound like this, but the special interests on this are huge. Something and that you can shape in some way that isn't writ large may be able to let us make progress and be built on.
I feel like the politics of this are harder than the politics of surprise bills, which, as you both pointed out, are less partisan and more special interest. Obviously, the drug industry is very powerful, but the Democrats in the House, when they had much bigger majority, had a really hard time getting a bill through because they had fights between their more moderate wing and their more liberal wing. I think Rodney's sort of right. It depends. It depends what you decide to do. Why have they not been able to decide to do something rather than?
And that's, what this is bringing me back to. What the definition of is? I mean, it really is. But this is what Washington has a really hard time with. When there are these very strong interests that don't want change, to be able to achieve that change is very hard. And it's not partisanly hard. Partisan is part of it. It's always part of it in Washington now. It didn't used to be. So that's there. But the bigger issue is just what's always been here, is that, there are those who are benefiting from the status quo and they don't want it to change. And to push against that, you have to be able to push against those interests and rise above that. And I don't think we've seen that happen.
Let me sort of put a different spin on Deb just for fun here, and feel free to eviscerate me for doing so. I'm okay with the use of the word special interest, but I also do need to point out for our audience, some people's definition of special interest is being told, I get paid, you're telling me you're going to pay me less. I don't like that. Okay, special interest, call it like it is. But we have a system in place that is the law. It works within the functions of the four corners of law. It's not like people are getting paid off the books or anything that is questionable here. This is our system. And if you want to change the system and tell people, okay, you're going to do exactly the same thing you were doing, now you're going to get paid less. It's not outlandish for people to go, I actually don't like that. And so now you have to make the case, and I absolutely respect where you're going, Deb, is making the case that it is an appropriate thing to do to question those payments. I'm with you on that. But
we've had pharmaceutical CEOs say that, they're willing to accept lower prices. So I'm not trying to use special. Yeah. I want to clarify. I'm not trying to use a boogeyman or anything like that. It is just, it's true. It's hard when you're taking on an industry. You could choose dairy subsidies to talk about. We could choose a lot of different things to talk about. To change happens. I don't want to talk about dairy subsidies, so just to clarify that. But, it's hard to take that on. And when you talk pharmaceuticals and lowering drug prices, it's a great soundbite, but how you do it is always more complex, and how people end up understanding it when the campaign that's run. I mean, look, we're all old enough to remember when we tried to add a catastrophic benefit into the Medicare program. That would have been a huge value to Medicare beneficiaries, but it was the pharmaceutical industry that killed it. And so it's a tough beast to go up against.
As is Wisconsin and Vermont dairy farmers.
I know, I didn't mean to pick on any dairy farmers. I have no opinion on dairy subsidies.
We have an audience question, and I will remind the audience that there's a Q&A button that you can ask your question, and it will get to me. It says, there's so much polarization around COVID adherence to public health guidelines. How do we depolarize it? I mean, clearly a lot of this is coming. I mean, we had a spat on the Senate floor this week over a senator not wearing a mask, and then another senator, your former boss, Rodney, who came up COVID positive. I mean, what is I know they call it virtue signaling, but is there something about setting an example here?
I've said this before, I'll say it in a public venue. It's nowhere. Listen, we need to take a long, hard look at ourselves. And that is, Americans are not individually responsible enough to be collectively responsible. I mean, it's on us. And if, everyone's got their example out there. I mean, it is, if you were in the streets when the networks declared for Biden, or if you were on the field when Notre Dame beat Clemson, or if you're the mayor of DC who, Deb, I'm sorry, who goes to Delaware for the event. I mean, everybody, we need to take a look at hard look at us. It's not an us, it's an I. What am I doing? What is that behavior I'm doing? Because we're all doing it. And, and for me to sit here and try to say, well, there's this magic wand that we're going to wave that changes the nature of how we are. I ain't got it.
So I want to be a little more positive, I hope. I mean, what I say on this topic, Rodney, I say we have a representative government, and it shows in what's happening in the Capitol these days. I mean, and it really is true in that, you have people, and look, my husband works in the United States Capitol. I am terrified that he has to go in there and be exposed to this stuff. And he has to, as part of his job. There is not responsible behavior going on Capitol Hill right now. So it's a very scary thing. But that's true across America. So I completely agree with Rodney, again, representative government. But I do think in a Biden administration, you will have very different conversation coming from the top. And there are efforts underway. I can't believe I didn't bring this, but for DC HealthLink, our slogan has always been get covered, stay covered, which obviously translates perfectly to masks. And so part of our effort that we're doing now is a get covered, stay covered campaign. We've sent masks out. Our contact tracers in the district have DC HealthLink masks. They're giving to people. We are doing everything we can to deliver the dual message of getting health insurance and wear a face mask. And there are national efforts coming out on this as well, where many of us will be teaming together. We need a change in messaging at the top, which will help this to some degree. It will help it some, but I do agree that we've got an issue in America where people aren't willing. The idea that COVID is a partisan issue is absurd. And if you want me to be Debbie Downer, it starts to scare me about how other things could become partisan issues. Cancer has always stayed out of partisan politics, but why is COVID in it? And cancer isn't, we are at a very bad place societally. And we have an opportunity here, I think, and I hope we're able to seize it.
Yeah, we are all old enough to remember after 9/11, like going into 9/11, Rodney, your boss was about to maybe cut a deal on what had been a big, fight over the Patient's Bill of Rights, which of course didn't end up happening until the Affordable Care Act. We just come out of this very divided populace with the Bush v. Gore fight. And yet right after 9/11 and then following the anthrax attacks a couple of weeks later, Congress just sort of put everything aside and became bipartisan. And I have to say, when COVID hit, I just fully expected that same thing. And it just didn't happen. And, you can say, well, the president, helped foment some of this, but not all of it.
Not all of it, but by leading it, it empowers it. And, we did see across high levels of government behavior that you saw, across the country, and people felt that they were doing what they should do. We don't have another example you can point to where leadership has played the role that has been played in COVID today. And so I think changing that will hopefully help if it's not too late.
And I am trying to be cautious with the magic wand value of that, because it is beyond that. We all have our confirmation biases, whether it is a Black Lives Matter protest or if it's Sturgis. We all have a confirmation bias that allows us to go, I can do what I want because other people I disagree with are doing what they want. And we have been like that almost since we came out of our shutdown, and that as we've opened up, it's been, what I want has been the dominant theme. And that's our core problem. Again, we are not responsible enough individually to be collectively responsible.
All right, well, we're almost out of time, but I want to throw one more issue log on this fire. Something that's creeping up while people are busy looking elsewhere is the impending insolvency of the Medicare Trust Fund. It could become unable to pay all the bills as soon as 2023 by some counts. I remember when that would have set off all kinds of red alert sirens in Congress. Do we have crisis fatigue, or is something going to happen here?
You're not going to like my answer. I think that it's not an if, it's a when that we return to the issue of going, okay, there's a problem here between the deficit, the debt, and then again, the impending insolvency date. The question is when. Is 2021 in the middle of an economic recovery, knock wood, is that when you want to have a conversation about austerity and what that might mean to try to drive that? And while I would like to say no, I could see folks on the right wanting to have that conversation because they think it will provoke folks on the left to say, what problem? And so I could see that happening sooner than later.
Yes, I would note that Republicans are always interested in austerity and the deficit when there's a Democrat in the White House.
Exactly.
Debbie, I probably just took your line.
That's perfectly fine. I'm happy to share, but that is entirely true. But the other thing I would say is, in 30 years, in my 30 years, on the Hill, and since, I can point to numerous Medicare Trust Fund reports that showed the sky was falling in 3 years. The sky hasn't fallen. I would also note that there is no insurance company that is held to looking at how many years of a trust fund, 20 years out, do they have available to pay for their costs. So some of this is a way that we manage the Medicare program is, it's built in that these kinds of crises are highlighted. We have always, every time, forever, figured out ways to make sure that, we did not hit a crisis. And I think Congress will continue to do that. I think a Biden administration helps in the ability to make steps on that front that makes sense. I think there's people on the right who probably salivate over what they think they might get Joe Biden to be able to do on this front. So, I think we're able to move this forward. And I have quit paying as much attention to it because I've worried about it so much. And then, these crises don't happen.
Yeah, although, usually these crises don't happen because Congress does something.
I agree.
I'm worried about Congress doing things.
I agree. I am too. I hear you. But, when Newt Gingrich was first elected speaker and he wanted to cut the Medicare Trust Fund by, at that time, $270 billion, cut the program, completely allow Medicare to wither on the vine. None of that happened. And we were able to instead build a more stable feature for Medicare. And if you had said to any of us, in the beginning, first 100 days of his reign as speaker, that's where we would end up, no one would have believed it. So I have hope on Medicare. I do think, Medicare is, it's been here a long time and people depend on it, and the people who vote depend on it because seniors vote. So I think we're going to be okay there.
So Rodney, questions, is Congress as responsible now as they were in 1997?
Again, I'm not predicting outcomes. I'm predicting the conversation.
All right. Well, I think we have time for one last audience question. It says, how will the vaccine be covered and reimbursed? I would note that Congress did manage to just sort of make testing free at the point of care, or almost, unless you went to the wrong place and got a $1,000 bill. Are we expecting the same from the vaccine?
We absolutely are. There's actually a rule that's come out from the Trump administration. An interim proposed rule came out on November 2nd, saying that the vaccine and the administration of the vaccine will be fully covered for customers, whether you're a Medicare, Medicaid, a group health plan, yada, yada, everywhere. I mean, it's going to be covered. It's a good interim proposed rule. Rodney, from the CARES Act. It comes from the CARES Act.
So I'm going to say something just to, has anybody thought about what is our process for tracking who has had it and who's got the vaccine, which vaccine, how many times they've had the vaccine? This is not a scale like we're checking childhood immunizations. When we talk about the logistics of what next, this is going to be very, very challenging.
That's a different issue than how will it be.
I know, but I was just going to piggyback. I wasn't going to disagree with you. So I thought, okay, how about open up a new kettle of fish? That'd be fun.
All right. Well, we're definitely running out of time. I want to give each of you like 30 seconds to please say something a little bit hopeful, because a lot of this has been pretty grim.
I'll go first, Deb, just real quick. Listen, for everything we said, remember, with close margins in Congress, bipartisanship will rule if you get anything done. Bipartisanship happens when advocacy makes clear to both sides issues are important. So everything you do matters. That's my 30 seconds.
Perfect.
Completely agree with everything Rodney said. And there are things in healthcare that don't have to be partisan. And so let's find those things and start with them. And we can make real improvements in people's coverage and in people's lives.
Well, thank you both. It is always a pleasure to spend time with you, even on Zoom. Looking forward to when we can do it in person.